Welcome to Your Health. Information about today's top health topics direct from Brigham and Women's Hospital experts. We want to remind you that this information should not replace the advice or recommendations from your healthcare provider.
Alzheimer's disease is a progressive, what we call a neurodegenerative disorder, which means that unfortunately the nerve cells in your brain that are important for thinking and memory and communication start to die over the course of Alzheimer's disease. So the most common symptom of Alzheimer's disease is what we call short-term memory loss. So this is having difficulty remembering what happened to you 5 minutes ago, 5 hours ago, and even 5 days ago. Typically in Alzheimer's disease, long-term memory, so remembering what you did as a child or in early adulthood, is preserved. In Alzheimer's disease, other cognitive domains are affected as well. As it progresses, Alzheimer's disease also affects language. And finally, unfortunately, most Alzheimer's patients later in their disease start to have lots of behavioral problems. Some Alzheimer's patients become agitated or paranoid, and behavioral problems are a big issue at late-stage Alzheimer's disease. When memory problems or executive or attentional problems get to the point where you're unable to function, and especially if people around you notice that there are significant problems, that's the time to go and talk with your doctor. Many times a little bit of forgetfulness is part of the aging process, but if it's really significant and it's getting worse gradually over years, then it's time to really talk to a doctor and make sure that this isn't early dementia. There's been a tremendous amount of work in trying to find things that might prevent the disease from ever beginning, or at least slow the progression of the disease. Some of this work is very interesting, but unfortunately, just a few months ago, the National Institute on Aging got together a very large panel of experts to review all of the data and found that at this point there really isn't any evidence that most of these diets or nutritional supplements really can slow the progression of Alzheimer's disease. I recommend that people take a multivitamin, and I recommend that they try to have a healthy lifestyle in terms of diet, eating a balanced diet. But at this point, I don't really recommend that they take very large supplements of one vitamin or of one nutritional component, because we just don't yet have the evidence that at this point that really will change the course of the disease. We right now have studies for almost everybody, from people who are totally normal, who either have a good memory or who are normal but are a little bit worried about their memory. Those are our early diagnostic marker studies. There are trials that are enrolling at the stage of what we call mild cognitive impairment. And these are for people who do have some significant memory trouble, but don't yet have a diagnosis of Alzheimer's disease. And we have several trials right now looking for individuals who are in this stage of mild cognitive impairment. We also have trials for individuals who already have a diagnosis of Alzheimer's disease in mild to moderate stages. It's been known for a long time that people who volunteer for trials tend to do a little bit better, and I think there's something about this feeling that you're doing something positive against the disease, even if it doesn't help you, but hopefully might help future generations. I would say that most people feel like this really gives a sense of purpose to their disease and dealing with it, and find it a very positive thing. And these people get to be kind of part of our family. We know them and see them often over 2 or 3 years as part of these studies, and it's really great to have a good relationship with them.
Thanks for watching Your Health from Brigham and Women's Hospital. A reminder, Your Health is intended for educational purposes only. It should not take the place of advice or recommendations from your healthcare provider. If you have questions about what you've heard, please consult with your doctor.